Okay, good morning. Today, I'm going to go over with you guys hands-only CPR. For those of you who are in 11th grade, you saw it last year in your health classes. If you're in 10th grade, you'll actually see this when you get to health next semester, but you already know how to do the whole complement of rescue breaths and everything. So that being said, today we're going to test out an infant CPR, but this is part of making sure you understand that if you don't have a breathing mask, that you can actually go ahead and use just hands only to do the procedure, okay? Tomorrow we'll do the review for before giving care, and on Thursday we'll take the exam. The first part of class will be set up so that you will do the review, we'll go over it. I want you to do it independently. That way you know what you have to actually study, which it shouldn't be too bad. It's only about 20 questions or so. The second part of class will do a Kahoot just to review. Okay? On Thursday, take the exam. Friday will be essentially makeup stuff because I have to give I have to do interns on Friday for people who need that. So if you have something to make up hands-on, we'll do that. I'm also going to give you a grade for your packets on Friday as well, so I'll pull you up individually and go through that with you, and we'll get some points for doing all that note-taking for you. Okay, so that's the rest of the week. Again, today our objective is going to be to identify signs of cardiac arrest in the baby through the prompts I give you, and then demonstrate how to do infant CPR. The other reminder is that if you have not turned in your history flyer, it's past due. Okay? In the red group, you have your current event due this week. All right? Any questions about any of that stuff from you guys? You good to go? Okay. So this is hands-only CPR. Hopefully, there it is.
Cardiac emergencies can happen when you least expect them. If you are unsure of what to do, you can make a difference by using a simple technique known as continuous chest compression or hands-only CPR. It's easy to learn and can help save a life. If you see a person suddenly collapse, check the scene for safety and see if the person responds by tapping him on his shoulder and shouting, "Are you okay?" If he doesn't respond, call or tell someone to call 911 or the local emergency number right away. Kneel beside the person and put the heel of one hand on the center of his chest. Next, place your other hand over that hand, lacing your fingers together.
Notice he doesn't have any gloves on. It's not really necessary from that perspective. If they're wearing clothing, you're just going to give compressions. You know, you do have kind of a barrier there. You're just trying to take precautions if you're going to get into touching the bare chest or giving the breathing along with the procedure.
Position your shoulders directly over your hands, keeping your arms as straight as possible and your fingers off the chest. Push hard and fast in the middle of the chest, at least 2 inches, then let the chest rise completely before pressing down again. Don't take your hands off the chest, just your weight. Chest compressions also need to be given fast, at least 100 compressions per minute. The down and up motion of each compression should be smooth and regular. Do not stop compressions except in one of these situations. You notice an obvious sign of life, an automated external defibrillator or AED is ready to use, another trained responder or EMS personnel take over, you are too exhausted to continue, or the scene becomes unsafe.
Okay, nothing different than what we covered yesterday. All right. For you guys that are testing, fine, you'll be up here with me. If you're not testing, you'll be working on page 11 in your packet. There's actually 5 scenarios that I want you to record your answers on page 12. I'm going to do a little hands-on demo for you so that you have a pretty clear understanding of what the expectation is. Again, it's got a few variances according to what we have done with adult and actually what we did with child. But If you refer up here, of course you need gloves. If you were paying attention, I said if you're only giving hands only, you're not removing any clothing, you're good to go without gloves. Okay? But yeah, you definitely should use gloves. Look, even if you are doing that same procedure, if you have gloves there, I'd use them. I'd use them just to take care of yourself. You know, it's more important that you protect yourself than anything else. Would you agree with me?
Yeah, exactly.
Yeah.
She's learning over it, maybe.
So your procedure, again, written down. Check the scene, check the person. For you guys, I'll tell you, the scene is safe. The parent says it's okay to help the child. You'll make your call after you check the baby. Remember, when checking the baby, you tap the foot for sensory purposes. If that baby's conscious, it's going to wiggle a little. The third piece, when I tell you that baby doesn't respond, head tilt, chin lift. I can't tell you how many people in period 1 lost points because they refused to actually get their hand up under the chin. But you need to do that. That's supporting the head and getting that airway open. Then look, listen, and feel for 10 seconds. I'll tell you there's nothing going on, and that's when you go to your 2 rescue breaths with 30 compressions. With your 30 compressions with a baby, with an infant, 2 to 3 fingers. Okay? 2 to 3 fingers. So I'll do a little demo for you. That way you know exactly what's going on. I have them all set up here. You'll be 2 minutes on the clock. When the last person goes, in terms of giving the breaths, I will make sure that I start the clock for 2 minutes. Okay? All right, any questions before I get going with this? Okay, so the scene is safe. You encounter the parent, you know, they tell you it's okay. Baby. The baby doesn't respond. Call 911, get an AED. There's no sign of life. Remember that you can always have your hand on the baby's head, keeping the head back. People lost points on this too last time. Okay, so 2 rescue breaths, 30 compressions, and you'll do it. The clock will be running. It'll be a 2-minute cycle for you guys.